Common causes for neck pain. Hi, I'm chiropractor Kalla and I run the clinic Dr. Neck Pain in Singapore. So today I want to talk to you about what is causing neck pain. What is the most common cause for neck pain? So if excluding trauma like car accident and things like that, of course those are the immediate big ones that will do that. And if you have an accident or something that you fall, let's exclude all that. All right, so what are the other big ones? There are 5 big ones that I think of. Poor sleep, okay? The second one would be flights. Third one, hunch over laptops, okay? Or you're lifting something heavy, carrying a luggage from the airport conveyor belt or things like that, or lifting something in a weird position, or cold AC draft. So how does this affect you? So poor sleep, what it does for you is that it increases stress hormones. So if you can't get comfortable sleep, the resting of your body and your neck, all right, that can create stress hormones and elevate inflammation in your body. So that's why a lot of my patients that I hear over the years, they try so many different pillows to get better sleep for themselves, okay? So how this then ties into flights. A lot of flights are crammed, bad sleeping in there. So if you're on a bad flight, if you're a big size guy, you're gonna be crammed in there, you're gonna be in a weird uncomfortable situation, okay, and you might be sleeping against the window or something like that, trying to get some sleep. That puts a lot of stress and strain on your neck. Same thing with being hunched over a laptop like this. That puts a tremendous amount of stress and strain in you. Okay, if you do that once in a while, fine, but a lot of people do that on a daily basis or even a weekly basis. And as we get older and we have problems with our neck, that creates a lot of undue stress. So we'll cover that part later on here. Okay, lifting heavy things. So if your neck is already stressed or strained, or you're trying to reach something in a weird position, like back home, car mechanics, because they would have to reach the arms and then try to start twisting it, puts a lot of stress and strain in the neck. Lifting something heavy, your luggage from the trolley, okay, that could be something very heavy and that could sprain your neck. Cold AC draft. So if you're sleeping or something, having a draft that the aircon is blowing on your neck on one side, that can give you a spasm after a couple of hours and creating a problem. This used to be a big problem in the 80s when cars didn't have an AC yet. So they would wind down the window in the summer or early spring when the cold air would kind of give a draft. So they would feel good, but after a couple hours of driving, they would get the cold air and they would have a spasm in that neck. One thing that all these 5 different causes have in common is that you probably already have a structural problem in your neck. That makes you susceptible to having these kind of problems. It makes you more vulnerable. If the structure is off, it already creates extra stress and tension in your neck. And when you're having your poor sleep or other things, that will kind of push you over the edge and start giving you a neck pain or even a spasm or a torticollis or something like that, all right? What this poor structure in your neck, be forward posture, bent neck or reversed neck or things like that, is increases stress in the ligaments, muscles, the bones, discs and tendons, okay? So these are the structures that get inflamed and irritated and then can create a muscle spasm in your neck or give you generalized inflammation and cause you having pain. So let's cover what are the few simple things that you can do to alleviate these issues. I've given this to a lot of people on their travels. So when they go on flights and they go to a new place and they end up having some kind of a problem or a muscle spasm, back pain, low back pain, neck pain or something like that, they don't necessarily know to find a therapist that can do the muscle work or they arrive at inconvenient hours. So what you can do, get this tennis ball, all right, put it on your back where you find a sore tight spot. You can lie it or you can press against the wall here. You can put it there or shoulder blade and all that. You can do that to do it yourself, kind of an acupressure thing, okay? So use that in emergency use. So I have a lot of people that use that in their briefcases. I personally prefer this hard knotted ball. I don't know if you can see the texture of it there. I prefer, it's a bit more firmer. I can get a better response when I put my on the floor or against the back. So that's what I prefer. Another single item that you have here, umbrella. Okay, it's the hook actually more that you're interested in. So if you're having some problems in the shoulders, it can be hard for yourself to press. What you can do, you can get the umbrella going on there, and then you can sort of kind of pull there. Find a spot and hold yourself, and then you can find angle. You can control it and get it there. So that feels pretty good, getting it there, so you can do that on your own self, all right? You don't necessarily need to call for anybody's help to do this. Let's say you're at home and you have these kind of issues frequently. Hot packs, cold packs. I prefer hot packs, increase the circulation, let the muscles to relax. Okay, this one is coming from Guardian in Singapore, but you can pretty much find them in any pharmacies or sports shop that will do this. Heat it up, put it in a micro oven or put it in the water or something like that, warm it up, and try to keep it up. Keep it there for 10-15 minutes. You can do it multiple times per day. Feels good, helps the muscle relax and increase the blood circulation in that area. Okay. Ergonomics. So let's say you unfortunately have to work on a laptop. I actually have a laptop right here. You can't see it, but it's over here. So if you are having to be working on a laptop like this in a bad position, try to get a stand, lift it up, get a separate keyboard. Fortunately for me, I don't work like this. I'm just making this video and I happen to have the laptop here. Most of the time I work on a giant screen. So what you want to be doing with the screen, I'm using a 34-inch screen. Make sure that the middle of the screen is roughly at your eye level, okay? Minimum, get the top of the screen a couple of inches above your eye level. If your top of the screen is down, you're going to be looking down all day long. So what you need to do, lift the screen up there, look in the midpoint. You'll have the best posture there for yourself. All right, mobile phone use. This is a big problem. This is a big culprit for people. They keep doing this all the time, okay? What you should try to do, get your phone in front of your face, doing like this. Yeah, you might look like a door, or people think that you're recording them or something like that. Don't bother about it. It's your neck. You try to spare your neck. So just by having your neck like this, leaning forward about 15 degrees, okay, from a normal position, you have a 5 kg load on your neck itself in general. Here, you're having a 12 kg load. The muscles need to work so much harder. But if you're doing like this, I see this everywhere all the time. They keep looking like that. The effective load on your neck is about 27 kilos. That's a tremendous amount of stress for the muscles to deal with, and you will get some problems. It's just a matter of time how quickly you will start having neck pains and degenerative changes in your neck if you keep doing that. A few other things that you could do if you're having tightness in muscles in your neck, stretching. You could do just a simple stretch like this, all right? I prefer to hold the resistance that you're pushing your head against your hand and you're holding it in a neutral position. You don't want to be in a compromised position to do it here because you could snap something, you could have an increase or worsen your disc pulse if you have something like that. Just do like this, hold it here, press your hand against it, hold it for a couple of seconds, relax, gently go out there for the next level, all right, hold it there for 10-15 seconds, go back to neutral and work it really hard and see if you can get further, all right? So you want to do that a couple of times, just get out all the slack that you can. Strengthening, what you could do, let's say you want to be strengthening our right side muscles, you could press your head like this against your hand just to get the muscle to be strengthening. Also the same thing to the other side. You could do it to the front side or to the back side. Or you can get one of those big gym balls. I like to put them inside a door frame and then just basically walk into the ball with your forehead or sideways. Just walk in there and hold your neck straight. So those are very good ways you can start strengthening your neck if you need to feel that you need to increase the strength in your neck. Okay. One very common thing is that you get tightness at the base of the skull here, the suboccipital muscles there. So one good way what you can do, here let me turn around like that, is to get some kind of you press your jaw against it, hold it like this for a few seconds, and then you start stretching yourself like this. Try to feel that you're getting the relaxation over here. Some will teach you that hold your thumb against your teeth, press down. That is something called post-isometric relaxation. So what happens is neurological. So if I contract my bicep muscles, neurologically, my tricep muscle will relax, okay? Unless you have a spastic or wheelchair bound, they will just go into a spasm. But because of this reflex of neurological reciprocal inhibition, what happens is that if I contract the deep flexor muscles in your neck, these has to relax. So if you're in a position like this and these are always tight, what you try to bring it back, press downwards, jaw, and then stretch it out. You can do that a couple cycles, you can do it multiple times today to help yourself. All right, so these are the few things that you can do yourself immediately, okay? Make sure that you try to work in an ergonomically best position. All right, good luck with that. You might be wondering, when is it time to seek professional help, all right? I'd say that if you're taking painkillers on a regular basis, weekly basis, multiple times per week, or you're going for massages, all right, and they just give you a relief for 2-3 days and you keep going there maybe 2-3 times a week, or if you're going every week, all right, if you're going maybe once a month or something like that and you still you don't really have neck pains regularly, then I think you're still good. But if you're taking painkillers on a regular basis, some people unfortunately do that daily, okay? it's time to see and find out what's actually going on with the neck, okay? You should go and get a couple of exercises done to see how the structure looks like. See if that's driving the problem there, okay? The same thing for massages. If your massage that you go don't help you, okay, they just give you a relief for a day or two, then yeah, maybe you need to check out the structure just to rule out any issues there. I personally love massages. I'll go for massages maybe a weekly basis or twice a month. All right, I've done that for years, but I do that for feeling good. I tend to lift heavy weights, and when I'm in a period of lifting heavy weights, I go there to massage my whole body to relax my muscles. I don't necessarily go there to have any kind of neck pain or try to sort that out, okay? I go there for feeling good. But if you're having there headaches or neck pain and you feel that you have to go there and you only get a relief for a day or two, yeah, go check out the structure of your neck and see what's going on. Also, if you are seeing a doctor and you're being prescribed muscle relaxant, that's a step over painkillers that you can get over the counter, Panadol and things like that. If you're, pretty much taking muscle relaxant on a weekly basis, you got some serious things going on there. You need to go get an X-ray done, all right, and maybe follow up even an MRI to see what's going on with the structure, what's happening with the neck, and then you know how to start addressing it. If the structure is off in your neck, you want to get that corrected, and that's something we can help you with. A lot of people here prefer to go for cupping instead of going for massages. So if you go seeing a TCM, doing cupping, tuina, or scraping or something like that, if you do that occasionally, feeling good. The cupping part, yes, it can help you getting some stagnant blood there, or help relieve some inflammation, get some fresh blood flow going on in the area. But if you're permanently in a state that you would need that regularly, you probably have a structural issue that is causing this increased muscle tension in your neck, maybe because of bad posture or even the structures off inside that you can't see. Best way to find that out, get an X-ray done. You can immediately get it measured and see what's going on with the neck, and then you can find out what's driving your neck problem. So if you need any help with getting an X-ray done in Singapore, or if you need me to have a look at it and show what I can do to help you fix that, please do contact our Dr. Neck Pain. You can WhatsApp us at 8138-6880. Contact me, we'll have a look at it, and we'll see what we can do for you and take it from there. Good luck.